Hi, I'm Seth Thompson. I am a safety and risk advisor with LeBaron & Carroll Insurance. I'd like to review with you what to do when a job site injury occurs. The most important part of handling a job site accident that involves an injury actually happens prior to the accident. Training your employees on accident and injury procedures is critical. It is important that they know in advance what their responsibilities are so that they will not be confused when the accident occurs. Additionally, they should feel comfortable reporting accidents and injuries promptly, knowing that they will be treated with care and respect. The moment a job site accident occurs, it should initiate a sequence of events. The first 24 hours are the most critical, but the process of managing the incident can go on for weeks or even months. When an injury occurs, 1. Immediately assess the injury and facilitate appropriate and personal treatment. Determine type and severity of injury. Ideally, a staff member trained in first aid can assess the severity of the injury and the appropriate action needed. For sprains, strains, neck, back injuries, and appropriate medical care will usually include a visit to a clinic or a doctor well-versed in evidence-based occupational healthcare delivery. An established clinic relationship facilitates prompt and appropriate treatment for injured workers. 2. After triaging the victim and providing prompt medical attention, it's important that the injury gets reported to appropriate parties immediately: supervisor, injury management coordinator, and insurance carriers. Timely reporting is one important result of effective training and results in rapid return to work and minimizing indemnity claims. 3. From the moment an injury is first examined, there should be considerations made as to when the employee will be able to return to his or her duties. Whenever possible, employers should facilitate a return-to-work process in order to minimize indemnity payments, because even small indemnity payments can incur long-term costs and increase your experience modification factor, or EMOD. Consider light-duty work as a means of getting injured employees working again as soon as possible. They can be given any type of work that you, as their employer, are comfortable assigning. 4. Communicate caring and concern as soon as possible. Letting injured employees know that you care about their well-being and you want them back on the job as soon as they are able. 5. Give the injured employee forms to take to the doctor. These forms allow the doctor to authorize return to work and note any temporary restrictions an employee may have. 6. Follow up with the injured employee by finding out how the doctor's visit went. Together you can formulate an appropriate return to work plan. 7. For a work-related hospitalization, amputation, or loss of an eye, an employer must report to OSHA or your local OSHA authority within 24 hours of the injury occurrence. 8. For a work-related fatality, an employer must report to the same OSHA authority within 8 hours following the incident. These are the very basic steps to handling a job site accident that involves an injury. If you would like help creating an appropriate accident procedures or training your staff, please don't hesitate to reach out. We would be happy to assist you.